Our organization represents children and families in Iowa. Our top 3 health priorities for the 2013 legislative session are the expansion of the first 5 Healthy Mental Development Initiatives statewide, Medicaid expansion as outlined by the ACA, and the creation of an insurance exchange that adheres to the principles set forth by the health advocates, which you all now have a copy of. For Iowa to be the healthiest state in the nation by 2016 and into the future, our state must begin to place greater emphasis on and make increased investments in the healthy growth and development of Iowa's children today. While children certainly are not healthcare cost drivers in the near term, health services, and particularly developmental and preventative health services provided to children today, can have the biggest impact upon future healthcare needs and costs. Iowa is positioned to be a leader in providing children the preventative and developmental health services that produce health gains and reduce costs. But this will require scaling up exemplary initiatives, particularly First 5, and establishing an infrastructure in both public and private health coverage that supports evidence-based child health practices. Every Child Counts is committed to working with lawmakers and state child leaders to these ends, drawing upon work in Iowa and nationally which meet the triple aim of improving health services, improving child health outcomes, and reducing overall costs. Iowa's experiences in the Assuring Better Child Development ABCD initiative, Project Launch, and the Help Me Grow Replication Project have established a knowledge base and expertise within Iowa to take additional steps to diffuse effective child health practices. Every Child Counts is also a member of the Health Advocates Coalition and supports Medicaid expansion, as well as developing an Iowa exchange which adheres to that coalition's set of principles regarding effective exchanges, whether a state exchange, a partnership model, or a federal exchange. Every Child Counts further emphasizes the need for the essential health benefits plans to provide child health coverage based upon evidence-informed guidelines, including Bright Futures. There will be great public and lawmaker attention to Medicaid expansion and to establishing Iowa's exchange this session, as there should be. At the same time, however, child health policy must not be ignored. Every Child Counts recommends that Iowa lawmakers build upon past work and successes in improving child health care services as well as coverage, and scale up and diffuse effective practices as part of their 2013 legislative actions. I appreciate the opportunity to share our priorities, and we'd be more than happy to get you any additional information you might want or need. Every Child Counts looks forward to working with you this session to ensure that prevention and early intervention strategies for young children are considered in order to decrease healthcare costs and improve health outcomes in the long term. The future health outcomes of our children today and of our state as a whole depend on this. Thank you.
Thank you, Danielle. And Kinzel. And Robert Bernard, sorry if I'm not pronouncing your last name right, I'm double reading your last name. Okay.
Good morning. Thank you for the opportunity to be here today, especially Senator Hatch, and for all the other opportunities you've provided to me. I'm here today as this very rare bird, I think. I'm here as a private citizen, a stakeholder of one, if you will, representing no one but myself. So, what I would like to see for our elected representatives is to begin to treat healthcare in Iowa as the economic development opportunity that it is. To begin with that, I have 3 suggestions. The first, we've heard it a lot of today, is to expand Medicaid eligibility to 138% of the federal poverty level for all Iowa residents. Without this expansion, we will continue to see cost shifting, where those who are currently covered will face increased premiums due to the care that is provided to uninsured Iowans at a loss. The policy choice of expanding Medicaid eligibility will allow some 200,000 Iowans to receive more coordinated and effective care than they receive today. Make no mistake, Iowa's not Calcutta. We don't let people die in the street when they've been hit by a bus. We think this is noble, but we currently choose to let 334,000 uninsured Iowans receive sporadic and, from a perspective of health, and well-being, ineffective care. Medicaid is far from perfect. Many have noted that today. But expanding the program in Iowa will deliver the initial promise of health care reform to the least fortunate among us. It will also begin to extend the promise of health care reform to middle-class Iowans whose compensation packages face unrelenting pressure from ever-expanding health care premiums. Everyone likes to talk about win-win situations. Here's the opportunity to deliver on that rhetoric in a meaningful way. Secondly, I'd like to see the number of primary care residency slots at Iowa's medical schools increase by 100% or more over the next 7 years. It's not enough to talk about being the healthiest state and to suggest that better individual choices will lead to that lofty position. Significant financial and programmatic resources need to be devoted if we are to become the healthiest state in the United States. One of the resources that we must expand is a vastly larger stable of Iowa primary care physicians. Expanding residency slots is one way to address this need. We can find the right financial and policy mix that will allow our medical schools to create more slots and our Department of Public Health to create more meaningful programs to attract primary care physicians from outside Iowa to our state. More slots are a great start, but we will also need to make intelligent use of physician extenders, including PAs and nurse practitioners, and undertake more aggressive efforts to retain our increased number of graduates, or at least I hope our increased number of graduates. Let's find the right policy mix to do that. Now, my first two comments involve policy actions and choices. My third comment is a little more esoteric. It involves fluid questions grounded in my teaching classes on public health care, law, and ethics. I've been involved in health care since 1990. I'm beginning to think that's far too long, but I continue to be involved. But not a day has gone by where I have not heard a call for cutting health care costs. I suppose the rest of you as well. What I haven't heard a lot of conversation about is cutting health care demand, okay? In Iowa and in the United States, one of our strongest modern growth industries has been the creation of poor health. Simply put, our society produces extraordinary levels of illness, much of it chronic and preventable. Cutting healthcare costs in an era of high demand will lead to greater rationing of healthcare than we currently experience. Rationing medically justifiable healthcare in an era of high demand is simply cruel. I ask that Governor Branstad and the leadership of the Iowa legislature therefore create a task force with a 3 to 5 year tenure and the staff and resources necessary to examine Iowa society with the goal of reducing the amount of chronic ill health that Iowa produces by 50% or more by the year 2012, or by the year 2022. Thank you very much.
Thank you, Ann. Robert Gennard. And to be followed by Ryan Ball.
Thank you, elected officials, for having this opportunity to listen to us today and learn from us. I'm just a private citizen. I live in Urbandale. I won't get into that. But I'm here to tell you that I entirely support the Affordable Care Act, what it's trying to do. I encourage you to strongly implement this exchange for the citizens of this state to help people that are in need for that. And my understanding is that I, who am insured, as I guess as many of you are, we pay $1,000 a year of our insurance premiums for those who are uninsured. Reasons are, for example, they don't get preventative care like we may have that opportunity for. They need to go to emergency services for things that we may consider to be routine, and my understanding is emergency services are more expensive in the operating scheme of things than they are to going for preventive medical care to see our physician. So it's logical from my readings to do preventative care up front, implement this program for those folks who are not they're down to the lower end of the economic schedule for us, and that will all help us, everyone out in terms of operations and some economics to go along with that substantially. And I'm going down a different fork in the road a little bit. I want to give you an example of that. I'm okay economically and things, but my wife, who's not with me now, fought a rare form of leukemia. She 2003, she was trying to work full-time. Her specialist said, you can't work full-time, you got to work half-time. So she worked half-time, and then they told her, you can't work at all, you've got to move. We lived in Boulder, Colorado, and I worked for the judicial branch of the government there in a high-level management position. She said, you can't work anymore, you've got to move to a temperate climate. That's at sea level to help her out with her disease and her comfort level. So we chose to do that. When we got there, we lost our insurance that we had, and I'm going to say that diplomatically, we had to experience the 17% administrative overhead for the average private insurance company for a long time before we could get her insurance, and that cost us a lot of money to get her any kind of insurance. And I lost my insurance for that. So I was the same process for myself to get new insurance. So it took me quite a long. I'm real healthy, but for me to get my insurance was hard to do, even for that. And then a few years ago, I had surgery. It was a small surgery, but my insurance company took my insurance away because I allegedly had cancer. I didn't have any cancer. No record said that, but I had to fight with them to get my insurance back. It just doesn't make sense. And I'm, as I said, better economically well off than people we're talking about helping here today. So follow through and get this thing done and help these people that really, need it. So I thank you for your opportunity today.
Thank you, Bob. And Brian Ball. And Brian is our last speaker. So I'll just ask if there's anybody else who wishes to speak. Please see Zeke, and otherwise we'll have closing comments by the three host legislators.
Thank you. Thank you for the senators and representatives for the opportunity at the forum and the opportunity to hear from so many other important healthcare stakeholders in Iowa. I'm Ryan Ball. I'm the Director of State Policy for the VGM Group, headquartered in Waterloo. The VGM Group is a member service organization for independent durable medical equipment, prosthetic, and orthotic providers. In general, we kind of have one main goal here, and I think it's shared by a lot of folks, which is that as Iowa looks at healthcare reform and continues to try to implement it, and we add tens of thousands of new folks into the system that have insurance, that we have an adequate number of providers to service them, and that Iowans continue to have access to quality and affordable medical equipment and the timely services that so many of the DME and O&P devices require after the fact. We believe this can be accomplished by three generally main goals as we look toward implementation, which is when we're thinking of reimbursement, understanding that a lot of DME-posts, it requires a lot of follow-up opportunities and a lot of service to make sure that that equipment functions properly and that the patient gets exactly what they need to stay in their home longer. Secondly, on the creation of the state exchange and the essential health benefits package, we would strongly advocate for DME-posts to be included in the rehabilitative and habilitative services and devices category. We know that that was not specifically stated, nor was any service specifically stated in the healthcare bill, but the 10 broad categories for coverage, we believe that DME and orthotics, prosthetics should be covered under that category, and they will provide a good return on the investment. And lastly, as Iowa applied for to be an ACO to serve their Medicaid patients, that we kind of take a look at the value that DME-post providers provide to the system, especially when patients are transitioning from the hospital back to their homes, and making sure that they have all of the equipment necessary to do so, and also helping those same patients outfit their homes with different devices and different equipment so that they can stay in their homes longer and stay out of more costly care opportunities and institutions. So again, we appreciate the opportunity to voice our opinions here and look forward to the continued dialogue as implementation moves forward.